The first thing you need to do about anything that works so well our company produces is human grade produced. You can actually eat it. And I actually do. I take the animal one. Shouldn't tell you that. But
hey, listen, I take a lot of my dog supplements. So,
well, my perspective is if my dog's gonna have it, I got to be able to eat it.
Exactly.
And I'm French, so I will eat anything just about, right? So but the key thing is here's what the audience needs to know. One TDC comes from the US. It's a US based company. The ingredients are US sourced. It's a beef tallow, a beef fat, mostly from Ohio, ironically, and many of them, of course, are grass-fed cows. But it's a US product made, and we will not compromise on that part because we have better control. We get the certs that we need to feel very secure about what we're bringing to our animals and to ourselves. And that's the main ingredient. And what's fascinating about this ingredient is what we do with it and how we manage it. We actually grab multiple oils from beef tallow and we put it at a very specific ratio. And that's where the secret sauce. So when people look at the label, they say, well, what's this proprietary blend? Well, the proprietary blend is actually that mixture, that ratio, which we don't divulge because that's our secret sauce. That's basically all that is. And that ratio that's been developed, we don't change it. We haven't changed it. I mean, geez, in over 8, 9, 10 years, because it works. So that's one thing you'll see about our product is we don't iterate it every year because it works. We don't want to change it. It's so effective. So that's where it comes from. It's the US, mostly in Ohio. And it's always the same formulation.
So this is a product that comes from beef fat. And so I'm assuming that you take beef fat and then you put it, does it have to be fat from any particular part of the cow?
It's the tallow. So it's the belly.
Belly fat.
People don't know this, but there's different types of oil in the tallow. And there's a slight heating process that creates the molecule that has incredible properties. So a lot of people know about fatty acids because they're not new, right? And there's a lot of folks that use fatty acids, which I think are very essential, the EPA and DHA. That being said, this product is not at all about EHA, DPA. So if you're doing that, continue doing that. But if you want something that promotes very effective inflammatory responses, so healthy inflammatory responses, this has a unique twist to it. And this is what's so different. What makes it so different, just kind of go into it, is one TDC has an affinity for white blood cells. So what happens is in the body, if you're taking a fish oil, for example, you need a lot of it to be therapeutic because you need to bring it up to be systemically at a high dosage enough. Well, the difference with one TDC is that because it's attracted to the white blood cells, it goes very specifically where it's most needed. And you don't need a huge dosage of it, which is more cost effective. And you need less fatty acid, which is less tasking on the liver. So there's a huge value from a health benefit for the pets as a result of that. And our good friend, common friend, Dr. Becker always tells me, always tell people, this promotes healthy inflammatory responses from head to tail. That's the way she describes it when she talks about it. And that makes a huge difference because of the affinity for the white blood cells. Well, it's not just going to help the mouth, and it'll do that really well, but systemically it's going through the whole body where it is most needed. Now, of course, we talk about the mobility part of it. And that's the part that's really fun because the mobility, most people get a joint product, which is fine. And I think there's a lot of value to that. There's, green lip mussels. There's a whole lot of different products that you can use that. Turmeric is one of my favorite. That being said, with one TDC, it's not just the joints, again, because it's attracted where the inflammatory cascades are. So what does it do? It's the muscles, it's the tendons, it's the ligaments, and of course the joints as well. So we kind of consider it of a more complete orthopedic care. So you're doing the mouth and systemically going throughout the whole body, seeking where those inflammatory cascades are, and it's doing miraculous work inside of those cells.
So it actually is attracted to the white blood cells, or is attracting white blood cells, which means, so is it attracted to those inflammatory areas, or is it bringing in white cells?
It's a very good question. So the body's natural response, as we already know, will send the white blood cells through a chemical reaction. I don't think we're going to go through the whole inflammatory cascade, which is a really complicated cascade. But the body, like if I hit myself, automatically the body is going to send the white blood cells as a chemical response. Now, that's a good thing. The problem sometimes is it over responds. So sometimes helping resolve the issue is difficult because you have a lot of inflammation. That's why there's different protocols that a veterinarian will use. But one TDC actually follows the white blood cells, and it goes to answer your question. And what it does after that, from a biochemistry standpoint, is it's pretty remarkable in helping promoting healthy inflammatory responses, which is the body's natural response. We're not interfering. We're actually enhancing and helping the body's natural, incredible way of working.
Okay. So if you had an animal, let's say with maybe an autoimmune condition, an overactive inflammatory reaction, would this product then be contraindicated, or does it go in and it help calm that?
Yeah, that's a good question. So what it does is it helps the body's. So if you look at the cascade, the complex cascade, there's some good parts and there's some negative parts. The negative parts is what we're trying to prevent. And I think this is more of where the immune response would come in. So one TDC's focus is on the good part. That's why we say it promotes healthy inflammatory responses. So it will not interfere, to your point. Of course, if you have anything specific, you should always check with your veterinarians just to be on the safe side. But we don't.
And they're going to go, you want to give what?
Well, and the truth is they should know about it. And to your point, we need to do a better job to educate them and train them to do that. What I love about folks like your audience is they get educated because they listen to your podcast. And then they go back to the veterinarian, which then the veterinarian says, oh, this person knows what they're talking about. I better start studying about it. And that's very often how we get veterinarians to contact us. We do a lot of work in the canine sports. We sponsor the USA team in dog agility. Really intelligent, mostly ladies, and super smart, and they're very picky at what they give. So when they discover one TDC helping with recovery and stamina and keeping them in the game longer, they're very excited, and they go back to the veterinarian, and the veterinarian's like, oh, if this person knows about this, I better learn about it and help my patients with it. So we're very thankful for folks like your audience because they actually help us help more animals.
Well, that is true. And I, over the years, learned a lot of things from my clients, because when you're dealing with a holistic group of people, a lot of times they're doing a lot of research and they're bringing things to the forefront, which is incredibly helpful. So on the instructions for this product, and it's the coolest thing, I should have brought some in with me, but they're little hearts. They're like a little gel cup that's a heart. You probably have some with a little, you call it a snip tip or something on it. So it's this really wonky looking little thing. It's very cute. There it is. And so the little tip twists off, or you can cut it off, but I always twist them because I never have scissors in front of me. And then it's got this squeezy gel inside, which is the one TDC, the fat, right? So could this be given with Cosequin for hip dysplasia? Yes, absolutely.
100%.
And I wouldn't do instead of, I would do along with. They're providing two different things.
Combine it. Exactly.
So in its instructions, it says you can twist that off and put it directly on the gums, which is a highly absorptive area. So that's any mucous membrane, really. Or you can just feed them the whole little gel cap.
Yeah.
So what are the indications for giving it one way versus the other than if you have somebody who won't let you touch their mouth?
Sure. I'm laughing inside here because you can't see this, but right over there is my dog. And the moment I did this, she's literally getting up, and she's an old lady. She's almost 13 years old. And she's like, she might even jump up. Come here, baby. Let's do this slide. Hang on.
Give me one, Mom.
I'll be right there. Come here. There you go. Come here, baby. So gotta do it. Come here, baby. Let's see Dr. Judy. So here's the soft gel. And then all I'm going to do is I'm going to squeeze it on her gums. And what she wants, she wants this. That's why she was getting up. So the short answer to your question, what I just did took 10 seconds or less.
Yeah.
And she's like hoping that I'm going to give her another one. She usually gets two. So the short answer is, if you do what I just did, then you're going to be able to put it on topically on the gums. So it's going to go transmucosal. It's extremely absorbent transmucosally. Very little is needed on the gums to be effective because it's so potent. Most of it, she's woofing it down. It's going through the entire body systemically. So that's the ideal way of doing it. Now, I do realize that you have some animals, you have some cujos out there, you don't want to put your fingers near them. So if you have that situation, what I would say is just take it as though it's a treat in your behavior when you first introduce it. That's very fundamentally important from a behavioral standpoint. You cut it open, you twist it open, and you let your dog come to it or your cat and let them lick it off. That's the best way to start. And then after that, over time, just put on the gums. If you don't put on the gums and just lick it off, or you put on top of food, some will get on the gums as well over time. And systemically, it will also help the gums over time as well. I think you got a couple of questions there. About
I do. And actually, one of them, I'm trying to type an answer. And that makes my computer wiggle, so I'm sorry. So somebody says, my dog has super bad breath. Any way to fix that? And this, in my opinion, will help because we're getting rid of inflammation, and that inflammation partly is bacteria. Not that this is killing the bacteria, but when we damp down that inflammation and get a better response, then part of the breath problem is going to go away. Now, if you've got really bad loose teeth in there with a lot of infection, this is going to help a little bit, but we still may have to, well, we still do need to get the bad teeth out of there. And if we've got particularly rotten roots in there, it's a problem. Is it safe to give it to a dog with kidney disease? My answer would be yes, but I'll let you back that up.
Yes, 100%. There's no contraindications with this product. The only thing I always tell people, this is a fatty acid. So if you have, the only thing to watch out for is if you have a dog or a cat that has pancreatitis. Why? Because it's a fatty acid. The good news is, even if they do, you can still give it. The beauty is, again, the absorption. So if you have a cat with stomatitis, for example, or some really severe cups cases and you can't get near the mouth for the dog, you put on the pinna of the ear, you split the soft gel, you put it on topically, about halfway through the ridge, and you split in both ears, and then you let it sit for 10 minutes. Transdermal, transmucosal, systemic absorption, and then you wipe it off. So that's one of the ways to do that for sure. And I think what's really important for your audience, and I think they already know this, the reality is gum health issues is not a question of if, it's when. So if you can be really smart about it and jump on top of it before those teeth are loose, because once they loose, you're not going back. The bone is eroded, they will be gone. And more importantly, you want to get them gone. You want to get the infection out because it's very painful. So if you prevent it, start them when they're 6 months old. That's when you start. Once the adult teeth are in, you start. Then you're going to help your pet. For me, it's not just it's a family member. So I don't want her to be in discomfort at all, orthopedically or the mouth. I personally brush every night her teeth because I know that's a key thing for her health.
Yep, it's gold standard.
I don't know if you had some other question. That's right.
Yeah. So will this replace our omega-3? No. This is in addition to, because that's your EPA and DHA, and
that's right.
And you need more of that if you're feeding a diet that's high in omega-6s. So it kind of depends on your diet how much of that you need, and also whether they have heart disease, kidney disease, joint disease. That's going to neurologic disease. That's going to dictate how much omega-3 you need.
100%.
After applying to the gums, is the absorption quick, or do I need to pull water away? You don't need to pull water away.
You don't need to pull water away. And one thing I want to tell your audience, which is really, really important, because we have a lot of, pet parents that are very anxious to do the right thing. And sometimes what they do is they put on their finger and they rub it on the gums. Don't do that. You're working way too hard. And second, if your dog has gingivitis, it is painful. That's the last thing you want to do is rub it on the gums. You just literally, like you saw me do it with Sasha, I just squeeze it on the gums. If you want to do a little bit of emotion, which you really don't have to, but if you want to, on the outside of the mouth, super gently, you do that. And it absorbs right through. It doesn't matter if you do it with food, without food. Personally, I brush her teeth, and that's her reward every night. So she doesn't want the teeth brush, but she wants the one TDC. So then she gets it afterwards.
Okay. Somebody wants to know about the soybean oil in the product.
Yes. So the soybean oil, that's one of those ingredients very controversial. And I would tell you the first thing you need to know, this is non-GMO. Number one, there are some benefits actually for the heart for soybean oil that is often not talked about. So we have no issue with it being there on the basis that it is non-GMO. So that's one of the key things that's fundamental for us. And again, I wouldn't take it if I didn't think it would be healthy, or my kids wouldn't have taken it all those years if it wasn't healthy for them as well.
Okay.
And there's a very small amount, by the way, of the soybean oil, even though it's non-GMO.
Okay. So have any studies been done about using this product in pets with cancer, as whether it's beneficial, harmful?
Yeah. So from a pathology standpoint, we've done like very high dosage to see what happens, and there was no pathology. So it's a very, very, very safe product. It's interesting you talk about cancer because, cancer specifically, as we all know, inflammation is pretty darn critical. So if you can promote healthy inflammatory responses, I think that's all the better in this case, for the patient. But have we done specific studies in relation to cancer and as an adjunct using 1-TDC specifically? We have not. Logic would tell you that if you can, promote, like I said, healthy inflammatory responses, that's a good thing.
Yeah, I would agree with that. Okay. All right, let's see what other questions flew by. Somebody says, love this product, been using it for years. Oh, hi, Deb Sawyer. She had a dog with cancer that did really, really well. Any food supplements or medications you recommend not be taken while using this?
Oh, good question. So there may be potentially drugs that your pet has to be on from the direction agreement with your veterinarian. There's no contraindications. As far as food specifically, again, there's no contraindications. The only thing to look out for is pancreatitis. That's the only thing. And we have a solution. You put it on topically. And I might stress something else as well. When the topical application, someone had mentioned some hip issues for their dogs. Personally, so my little Sasha, she's super athletic and she's almost 13. Well, she did a lot of Frisbee and unfortunately her knees kind of give up. She's had CCL tears. So I know at her age that as far as the knee being inflamed, that's going to happen. So I give it to her on the mouth, but every night I actually pop one of those and I put it on topically on the knee directly. That's something that a lot of canine rehabs do, because if you're rehabbing an animal and you have discomfort there, this will promote super healthy inflammatory responses. Or if you do laser therapy after laser, I bet some of your audience members may already have their own laser. It would be my guess. But you do your laser therapy, you part the hair, you put it on topically. Why? Because laser increases blood flow. It also increases white blood cells activity. Well, guess what? When TDC does, it works with the white blood cells. So you're enhancing whatever you're doing there to help your pet.
Okay. Any problems with pets with beef allergy?
I love this question. So here's the deal. 1-TDC has 0 protein in it. And as we know, generally, not always, but generally, allergies derive from protein. So technically, if a dog or cat has a beef allergy, I would first I check with my veterinarian, but I would test it to make sure that there's no reaction. You should not, but we should be cautious. So and reactions on allergies usually are pretty quick. So you should be okay, but I would do it cautiously just to be safe. And by the way, there's no shellfish in this product. There's no chicken product, byproduct. None of that is in the product.
Okay. Would it affect cholesterol levels? My thinking would be no.
It doesn't, but if you think about it, what is cholesterol? It's something coating an artery. Why? Most likely because it's inflamed. So truth be told, I would actually challenge that it might actually be very good for that. And it's a small amount. Remember, we're not dealing with a high, like a fish oil where you load it up really high. This is a very low dosage of fatty acid.
Right. Can you use it if your dog has elevated liver enzymes? Again, I would say it'd be fine. It, again, may help because you've got some inflammation going on. Can it be used with Triacta to help heal joints? I don't know what Triacta is.
don't know that I know it, but I'm going to venture to say that whatever's in our product is not at all in their product.
It's not going to interfere with it. So I think it'd be fine. All right.
No,
People want to know what the shell, the little heart, is made out of.
Mostly it's carob. So it's obviously all human grade. They don't have to eat the soft gel, just truth be told. My dog wants to rip it off my hand, but they don't have to. They don't have to eat it. Like a cat will not. Well, there's exception to that rule, but cats usually they don't eat the soft gel. So,
yeah,
like for example, Sasha.
I have one dog who likes the gel cap. So after I squeeze it out on the other dog's mouth, then the other one wants the gel cap. So one likes them, one doesn't. So I'm like, whatever, you guys make up your mind. And sometimes I just throw it away because I've used the important part on the inside.
That's right.
If you're giving it, do you cut down on the omega-3? It's not the same thing. It is a fatty acid, but it is not an omega-3 fatty acid. So I would not change what I was doing with my omega-3s. And the omega-3s are really important if you're using this for joint health and joint inflammation. Omega-3s are really critical for that. So I would use both together for sure. Will it help a dog with alopecia? I would say it depends what the alopecia is from.
Yeah, that's a good question. It's exactly right. It depends what the source is. It kind of think of it, if there's anything that could be benefiting from healthy inflammatory responses, it's worth to try topically. On top of systemic. I mean, we've had I got to tell you, we've had so many people telling us how we should be using it and telling others to do it beyond what we even know. I'll give you a perfect example. Dog agility and dog sports. A lot of those dogs, a lot of times when you go on and off season, they rip their pads and it's painful. So they clean it up and guess what they do? That was Susan Garrett actually that was telling me about this. They actually take the soft gel, they cut it open and they put it on topically. And they told me, said, Olivia, you have no idea how much faster it recovered as a result of that. And we know because it happens a lot of time. Like flyball dogs, for example, is notorious for that. So there's so many different ways that you can use this topically as well.
So, all right, we know that cats can take it. We know that dogs can take it. We know that humans can take it. Can I use this on my horse who just put a staple through his chest yesterday?
Oh my gosh. The answer is yes. We actually have a horse cream, which you usually need a bigger one. It's good for the muscles and it's actually good for the scar tissue also to kind of break that down and to massage it into. But so the answer is yes. I have to tell you, it's been used in a lot of animals. So our chief medical officer is actually a veterinary dentist, and he's worked with Homeland Security, CIA, all kinds of different things that he can even tell us about. And apparently, I've been told that it's been used with dolphins. It's been used with all kinds of animals that we don't even know about.
Very cool.
It's good for birds too. If you have like joint issues with the bird, you just put it on top. I would not put it through the mouth, but I would put it topically on the legs to help with that as well.
Interesting. All right. Well, now I got to get another bottle from the warehouse so I can go smear it on my horse's chest. I went out yesterday to feed him dinner, and he had a fence staple. I mean, it's a big U-shaped thing, about that big, that he had impaled into his chest. I'm like,
poor guy.
Yeah. How'd you do that? Like, I still can't figure. It didn't come out of a fence, so I'm thinking they're all itchy with the flies and allergy season.
Yeah.
So I'm thinking he was rolling and probably scratching on the fence and then went down rolling, and a staple must have dropped into the ground, but he somehow managed to impale himself with this thing.
Poor guy. So,
yeah, it actually looks pretty, we got it all cleaned up last night and it actually looks pretty good, but I'm thinking, well, we could help this along. We need a good inflammatory response here. Yeah,
it'll help with the skin improvement. And sometimes like, if a dog or cat had some form of surgery, obviously you're not going to put on the incision. You don't want it to be painful for the pet, but you put it around it because usually they're shaved by then. And you put it around them, and it really does help promote very healthy inflammatory responses in the site. So it's so good for them.
Okay. All right. Somebody says Triacta's I figured it was a different country. Canadian joint support that has MSM, glucosamine, chondroitin. Okay, perfect. How long does it take to see an effect on joints?
Yeah, that's a good question. So we usually say 30 days. And the reason why we say that is because if I tell you it could be a week, you're going to be waiting for a week. And if you don't get the response that you want, you're going to say it doesn't work. So we usually say 30 days. Usually older dogs benefit from it faster. But usually 2 to 4 weeks. Sometimes there's exception to that rule. Sometimes it can take up to 6 weeks. Now, from a periodontal, from a gum health specific, you'll see results within a couple of weeks, and you'll get full benefits within 30 days. And it's really important because that bad breath that you're smelling, if it's not a gastric issue and it's actually a oral health issue, usually there's an underlying sign of something else that's going on. So using that is at a minimum. Obviously, you want to talk to your veterinarian to check it out, do X-rays or whatever you need. But it's the byproduct, like that bile from the anaerobic bacteria that you're smelling that's just really stinky. But you'll see an improvement, and you'll see also the gums. They won't be as big, and if you have a little bit of liquid coming out, you should be able to see that that's improving pretty quick generally.
Okay. Yeah, I'm using it on my guy who's in kidney failure, and his breath is beyond bad, and he's getting kind of ulcerated, and so he was the one that was like, all right, we're gonna go whole hog on this stuff and try it out, and he actually really likes it, so that's a good thing. So this person says, can I eliminate Cosequin and Duralactine? It's the only thing that combo is the only thing that's been working. So what I would say, before you eliminate anything, add this on, because anytime we add a supplement, when you add a drug like an aspirin or an NSAID or a steroid, it's drugs, you get a pretty immediate response. With any kind of a supplement, 10 days is the minimum. Usually we're looking at 3 to 4 weeks because we're asking the body to heal itself rather than just damping down the symptoms. So for something like that, I would say add this in 3 to 4 weeks. If the dog is doing well and you want to try backing off a little bit on one of the other supplements, do that slowly and see if you get a decline. If you get a decline, then you can't live without that one. Then you can try the other one. So if your dog is doing well on something and you want to add something in, that's great. But if they're doing well and you want to take away something that they're getting that's helping them do well, make sure you've got your new whatever it is built up in the system enough that you're not yanking the rug out from under them without having something else in place.
Yeah, and I'll tell you what to expect as well, especially if it's an older pet. Even on some of the other supplements they use, you see them kind of circling before they lay down, that they really have a hard time getting up. Pay attention to that. And I totally agree with you. You want to keep your baseline as it is, because otherwise you won't know what it's doing. But that's some of the symptoms some of the benefits that we can visually see they're doing better. Or a cat, they need that interim step to jump up, but all of a sudden you realize, they're jumping up directly, like to the football, since they've been using one TDC. So there's little things that you can look out for. The breath, well, that's pretty straightforward. You'll smell that pretty quick, hopefully improving.
Yep. Okay. Can it be given to an older cat that has hyperthyroidism? I would say yes. Yeah.
Yes, it's there. Yeah.
Help with that. For dental reasons, to use one TDC, do you wipe it on the gums? Yes, or just squeeze it on the gums. And for a 14-pound dog, how often would you do it?
Good question. So depending on the age, if you're doing prevention, I would say go straight to a maintenance dose. So that would be one every other day. If it's an older dog and you're battling something, especially in the mouth or orthopedically, I would say give one a day for 30 days and then ratchet down to one every other day. That would be the dosage. You can't overdose this product.
So if somebody gave it every day, like for me, it's just easier to do it every day. Otherwise, I can't remember whether I'm on an on or an off day.
Yeah.
And my dog actually needs it every day right now, so it's fine.
Yeah. You could. So I'll give you an example. For example, the folks that have athletes, those guys build a lot of lactic acid from the athleticism that they do. So it's not unusual that they'll stay on the one a day if it's if it's a smaller dog, like 25 pounds. So they keep them on the loading dose. It's perfectly safe. But, there's also a cost factor. So if that bottle can last like a 120-count bottle for a 25-pound animal every other day, that's 8 months supply. It's incredibly affordable, and it's doing a lot. So that's one of the values. But, if you can't afford it and then you want to keep on one day, no problem with that. Yeah.
Okay. And yes, it can be taken with our deer velvet. That's no problem. So any joint supplements that you're using, this is going to go along with it. And if you're using NSAIDs, anti-inflammatories, it's going to be fine with those. Can't wait to tell your animal chiropractor about this. We'll definitely use. There you go.
And trigger points. So if they're doing myofascial release, your chiropractor, trigger points. So actually topically put it on. If you know, like you have a hot spot somewhere, you can feel it, put that on before they do the treatment and you'll have a greater release. That's also some of the benefits of using this in conjunction and talking to your chiropractor.
Cool. Yes, it can be used in conjunction with the dental drops. And so I have someone right now whose animal has pretty bad stomatitis. And they've been using the dental drops, which has been helping, but I had them add in the one TDC. So they're doing one in the morning and the other one at night, and they're getting a much greater effect. So that's what I would recommend doing with that.
Excellent.
All right. Been using it for teeth only. My dog at times had a limp when he got up. The limp went away. So I had the added benefit of that too. There you go. All right. I think somebody said, I'm using Zoom at work, so I can't Zoom on this right now. When will we announce the winners? I don't know when Gwen's doing that, but I'm assuming that's a Gwen thing. I'm assuming she'll email whoever wins. I don't really know. I don't see her on here. I don't know where she is. 11-year-old border collie with Lyme's was very ill, recovering. Yeah, I'd absolutely use it on that dog. Joey, who does our video work, says his dog absolutely loves the one TDC. She's been taking it for 2 months, and she's pretty gimpy. So I'm glad she's on it.
That's a good testament right there.
Yeah, she's an older dog, and she's a big girl, and so she's just a lot of stress on her joints, and so she's been really struggling getting up and down and pretty gimpy. And I actually haven't seen her walk around the office. I haven't been to the office for a little while, so I'll have to go see how she's doing with that. Elderly dog with hip issues giving way. Will this really make a difference? Well, you don't know until you try. I would say it certainly has the potential to make a big difference for her.
Right.
You know what I need to, I haven't seen Michelle Allen from Monkey's House on here, but I mean, she's got 24 hospice dogs living in her house. They're all ancient. Wow. I should take some up to her and have her give a try, because man, talk about a good test case. We got 24 old gimpy dogs.
Yeah. Yes.
And they all come with horrible dental disease.
That's the thing, is they correlated, right? The bacteria that are in the mouth, they don't just stay in the mouth, liver, kidney, and the joints. Yeah. So, and the older dogs is where you get the most visual benefit. You as a pet parent, you feel so good when you're helping. Prevention, start there. But the older ones, it's a no-brainer.
Yeah, I mean, prevention, it's one of those, people say to me, like, we get dogs with mast cell cancer, and so we'll put them on these huge regimens of supplements. And people say, well, how long do I have to keep them on this? And I'm like, probably for life, but I don't know. And they're like, how do we know if it's working? I said, well, if your dog doesn't have a reoccurrence of mast cells, cancers, or tumors, and, if things are going well, me personally, I'd be afraid to stop, because you don't know if that's what's preventing them from coming back. So it's sort of, so when you're using it for maintenance, when you start 6 months old with a puppy with this, and you've been using it for 5 years, and you're like, well, they don't have dental disease and they're not gimpy. Do I need to keep doing this? Yeah. The answer is yes.
And as well as I do, until you've had to remove a bunch of teeth and go through the expense and the discomfort of your pet going through that. Once you know that, then you experience that, you don't want to do that if you don't have to. And obviously, one TDC is not going to prevent the need for proper dental cleaning at time. Certain breeds are prone to it, no matter what you do. So you still want to do the right thing for your pet.
Yes, you can use it along with teeth. It's okay with PEA. Can you give your 25-pound pug, 8 years old, 2 a day, one in the morning and one in the evening? I don't think she would need 2 a day. I think she'd only need 1, right?
You wouldn't need to. I think 1 a day would be plenty. And check that mouth. Frankly, take pictures before and after, especially if they have pink gums. You'll see a difference. But 1 a day should be enough.
Okay, somebody says, can I take this also? And if so, how many? I weigh 110 pounds.
Okay, I'm not sure I should tell you this, but I actually just take the animal product myself because I said it's human grade. So I take 3 a day.
3. There you go. So maybe Allison, you could get, or Tracy, you could get away with 2.
Well, and Dr. G, you might want to end up carrying the human product because I don't want you to have that subject. It's uncomfortable.
Actually, we have a lot of human products on our website.
I would tell you, anybody above 35, as far as having inflammation in the body, it's not it's a win. So any good diet, good exercise, and good quality products, fatty acids, it's a must. My wife is a nutritionist. Believe me, we all take this product at home, and there's a pain comfort cream for it too. That's
start my husband
sent you some of that. I got to send you some of that. That's
okay. Really, send me some people stuff. What was the recommendation about using with a chiropractor adjustment? Somebody goes.
So that's a good question. So a chiropractor is usually realigning everything, but there's generally certain spots that you can feel there's a bit of a bulge. There's some heat situation that's taking place. So if you actually part the hair and put a soft gel prior to the chiropractor doing the manipulation, it will actually release some of the myofascia, and you can have a better adjustment. Same thing with acupuncture, by the way. If you do acupuncture treatments and there's certain areas that your veterinarian's working on, or on the human side for that matter, you put that in. So you're decreasing some of the area that's having discomfort, and as a result, you can have a better response to the manipulation that's provided by the expert.
Perfect. She says, awesome, thank you. Do you squeeze it on your teeth? On your gums, I would think, right? For people?
Personally, I do. But you have to remember, it's the natural, there's no artificial stuff in there. It's for flavoring because it's a natural flavor. It's good. So on the human side, as I said, I'm French. I eat just about anything. But that being said, you may not like the flavor. I know my wife doesn't like the flavor on the gum. So we're working on having that develop on non-flavored.
Well, but the thing is, though, if you don't like the flavor, you could just use it topically anywhere and it's going to absorb.
Right. Well, and we have a cream on the human side too. So you can.
Well, I guess we need
cream in your mouth.
We need information on that stuff. Somebody says on their torn meniscus. Yes, absolutely.
Oh my gosh, yes. So wait, hold on. I have to tell you something. On your torn meniscus, you can take the animal soft gel, squeeze that for sure. And the key thing with the meniscus is, if this was your knee, you put it where it hurts, but you put it all around. And you wait about 5-10 minutes, see how it feels. And if you want more relief, do it again multiple times in a row. So that's a great way to test it as well, to see if your body's responding to it.
Okay. Somebody says, how long after the expiration date is it still good?
I don't even know why we put an expiration date, truth be told. I've used the product 3-4, we've even questioned that in our company. Like, why do we do that? It's like,
I think you're kind of required to, which, for some things, like some of our herbal products, like it has to have an expiration date on it. I know that Jing Tang Herbal, they used to have expiration dates and they were usually like 3 years out, but they quit doing that, and instead now they just put the manufacturer date on it. So when it was made, how old it is. But literally, I think I'm feeding my little guy an herb right now that I've had in the cabinet for about 8 years, and he didn't need it in between. So I'm like, well, you need it now. So the herbs, particularly if they're stored in a cool, dry place, and I would say the same with this, store it in a cool, dry place. It's going to last like this because it is a fatty acid. You do not want to store it in high heat. You do not want to store it in direct sunlight, even though it's not a clear bottle, but you don't want that heat on it. So to me, that would be the most important thing for storage as far as longevity of a product.
Yeah. And I'm glad you mentioned that, because sometimes some of the audience might be in places like Arizona, where it's quite hot, during transport. So here's the good news about 1TDC. As I mentioned, there's multiple oils put together from the beef tallow. And sometimes when it's exposed to heat, the oils will separate. And the good news about this particular product is it will not impact the efficacy. What you will experience, though, it'll be more oily, or you have some granularity in it. That's still okay. The best thing to do is you just put it in the fridge overnight, and it should, bring it back into more of a pasty position. And the other thing too, this is one of the few complaints that we do get, so I want to address that. Sometimes people say, soft gels are so hard. I don't understand. The last bottle I had, they were super soft. Well, this transition of weather, humidity, and so forth can have an impact. The reality, and this is kind of goofy, what I'm going to tell you, but it really does work. If you put a little tiny piece of bread in the bottle overnight, it softens the soft gel, and it's very safe to do that. Then a lot of people do that. So if the two separate oils, put it in the fridge. If the soft gel's gotten too hard, then just put a little piece of bread overnight, and it does work. It was suggested by one of you guys, actually, that taught us how to do it.
See, it's like getting your brown sugar to not be one hard lump. You put a piece of bread in there, it'll work fine.
There you go.
How do you order? It's on our website. It's on drjudymorgan.com. Joey, if you're on, maybe you can put a link to it, or Sweta, or Caroline. I don't know who on my team is on right now. I don't think my daughter is, though. Do we ship to Canada? Oh my God. Canadian shipping, it's not our fault. Customs is being awful. Like, we literally have had stuff sit in customs for months. People yell at us for it. I can't control that. So I'm not going to give a direct yes or no on that, because it's been a nightmare. Our company goes back and forth between shipping things to Canada. The other thing is sometimes the customs fees are higher than the price of the product. Like,
I know.
It's a little crazy.
It's so, I mean, we're neighbors on it. Couldn't we figure this out?
Do you, does your company ship to Canada? You don't ship direct to consumer, right?
We do some direct consumer as well, but mostly veterinarians as well. But to Canada, we do. We just have I feel so bad that it's a flat fee, like I think $15 of them, something shipping US dollars.
Yeah, it's ridiculous.
No, that means.
Do you have any veterinarians who use it up there?
Yes. So anyone in Canada can go to the veterinarian, bring a print and tell them it is available through their distribution. So they have, even if they don't know the product, you can insist and say, I was on the Dr. Judy Morgan's podcast. I know this exists in Canada. I heard the co-founder said that it was, and they can request it. So, and then frankly, they should start using it with all of their patients.
So our products, our Deer Velvet products, are sold through the website Dog's Age Canada. It's a senior dog site. And I'm sure that she would carry it. So you and me and Gwen, we need to hook up and loop her in. And I think that might be a way that we could, that she would get a whole bunch and be able to get a distribution in Canada as well. I think that would be a good idea.
That's good.
Okay. Let's see. I'm all over this for my pups, and we'll make sure they get the benefits, but I'm a vegetarian, so I can't get myself to squeeze this on my gums. You don't have to squeeze it on your gums, but give it to your dogs. It's still, and your cats. It's good for them. Expiration dates are required, not applicable to some things. Yeah, I agree. So
the short answer was, if it's past the expiration date, it may smell a little bit more, and then the dog's gonna like that even more. But it's very safe.
Is there any rosemary in it?
No, there isn't.
No, I didn't think so. Gwen put it on. Gwen is on. Thank you, Gwen. So Gwen put a link on the Facebook page in the comments with it on our website. So that's good. Let's see. All right. Canada is awful. All good natural products to be a problem. This ship doesn't make sense. It's just, Canadians can order through Pets Drug Mart. Okay. Don't know who they are. But yeah, it's just for us right now, shipping is COVID just totally screwed up shipping to Canada. We used to ship a ton of stuff there. But then once that happened, everything just got clogged up and sat forever and ever and ever. Okay. Olivia, is there anything we didn't talk about with this product that you want to make sure everybody knows about? We covered a lot of ground.
We covered a lot of ground. I think, and I really like the way you stress, is it's not a replacement. It's something that enhances perhaps what you were not tackling as effectively. And it's a different modulation. It's a different approach. But for the mouth, there's tartar and flax products, but when it comes to the gums directly, this is the number one product in the US for gum health and joint health in one economical solution. So that's the stress. And that's what veterinary dentists use, and veterinarians. So my plea is cats and dogs by the age of 3 years old have some kind of an issue. Don't wait till you have an issue. Be proactive. Yep. So that's really my request to help those pets live a longer life.
And we say the same thing with our Deer Antler Velvet Wellness formula. It's meant to be started as puppies because we're trying to be proactive. We're trying to prevent the joint breakdown. We're trying to prevent the immune system breakdown. So we're, it's got a little bit of colostrum in there. It's got the algae in there. It's got the Deer Antler Velvet, so that we're supporting and promoting good health rather than waiting until the ship sailed. It's a mess. It's 3/4 underwater. And now we're, trying to climb back. Think of the Titanic's going down and you're trying to climb back on board. Start before that.
Yeah, that's right. Yeah,
but if you didn't start early on, at least catch up now. So, I mean, I love products like this. Stuart, I know the ship is going down. His Titanic is sinking quickly. But if I can make his mouth less painful in that process, then, I'm going to go all out and do anything I can. So, okay. So Gwen will pick the winner and let whoever know, and, or winners. I don't even know what we're doing. Can it be given in pregnant dogs?
So the disclaimer said that we haven't tested for that or did the research for that, because that's, again, what, NASC labeling that we follow. That being said, if your pregnant dog can eat beef fat, there's no reason why you couldn't. Okay. It's really that simple. So check with your veterinarian, but yeah, it should be safe.
Yeah. I mean, it's certainly not going to cause abortion or fetal resorption or teratogenic effects. So not worried about that.
No, absolutely.
Okay. Oh, somebody just said, Sonia Phillips, you won. Kelly Broussard, nice. You also won. Okay. I guess she's posting them now.
Nice. Congratulations.
All right. Cool. All right. So, all right. The product link is in the comments. I'm sure Gwen will post some more information about it. But like I said, once I got educated on the product, I was like, oh, duh. Should have jumped on board 6 years ago, but I didn't. So we're here now. And Olivia, thank you very much for your time. This is the second time you've had to run through all that with me, but I appreciate it. And the more that I learn about the products, the easier it is for me to explain everything to people who ask me questions. So I really appreciate your time, and we really appreciate the effort that your company puts into these products. So if you would be so kind as to send us information for the human products and other things that you have, love to hear about them.
That sounds good. Well, thank you for your time, and it's always a pleasure to talk to you.
All right, everyone. See you tomorrow. Don't know what we're talking about, but I got a few things in mind. Bye, everyone.
Take care.